Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We're going to be talking about ovarian cancer, and before we do, down below, let me point out that in the YouTube description box is a link to the Healthcare Advocacy newsletter that contains the script for today's video. It also has tons of references on organizations you might be interested in that support universal health care, reproductive rights, and it has lots of references in case you need help with your medical care, like with denials. Okay, let's get started. Ovarian cancer is a type of cancer that develops in the ovaries, fallopian tubes, or peritoneum. That's the lining of the abdominal cavity. It's one of the most common gynecological cancers. It often does not cause symptoms in the early stages, which is the big problem. As the cancer progresses, though, symptoms can include abdominal pain, bloating, pelvic pain, vaginal bleeding or discharge, frequent urination, constipation, loss of appetite, and then weight loss, and then fatigue, of course. There are 4 stages. Stage 1, the cancer is completely contained in the ovaries, and good news, if you can catch it then, 90% of the patients are cured. Stage 2, it has spread to the other pelvic structures, and the 5-year survival rate drops to 70%. Stage 3, it spreads beyond the pelvis, and the 5-year survival rate is about 40%. And then at stage 4, it spreads outside the abdomen, and the 5-year survival rate is only about 20%. Early diagnosis of ovarian cancer is challenging due to the vague symptoms and a lack of screening tools. Now, a team at the University of Manchester aimed to evaluate 2 simple non-invasive urine biomarkers, CA-125 and HE4, for diagnosing ovarian cancer in symptomatic women. Paired urine and serum samples, so they got both ways, were collected from women undergoing treatment for ovarian cancer, those are the cases, or investigations for gynecological symptoms, those are the control people, and they were tested for CA-125 and HE4. They found that the urine CA-125 and HE4 levels were higher in women with cancer compared to the controls, and that a combination of urine, CA-125, and HE4 had a sensitivity similar to that currently used for serum CA-125 for the detection of ovarian cancer. I will point out, this is off script, it is not perfect, but it gives pretty high confidence that ovarian cancer may be present if you find it, because serum CA-125 also detects other things like endometriosis. It's affected by those, but it's a good start. Anyway, this study suggested that CA-125 and HE4 could be used as a non-invasive diagnostic tool to triage women for formal ovarian cancer investigations, and could be used as a point of care testing in the community or in low resource settings. Anyway, the link to the National Institute of Health report is in the newsletter. So there's a way to go, but they're moving in the right direction. Let me talk about a breakthrough treatment, because this was really exciting. Ovarian cancer remains one of the most challenging ones to treat because it affects tens of thousands of women every year. It has a lifetime risk of 1 out of 87. It's known as a silent killer because it often shows no early symptoms, and that leads to late-stage diagnosis and then those grim survival rates. But a recent breakthrough might offer some new hope. These were researchers at the University of Alabama Microbiology Department. They discovered that ovarian tumors use interleukin-4, IL-4 molecules to evade immune system attacks. Now, while current treatments like surgery and chemotherapy can hopefully get rid of or shrink tumors, many patients experience recurrence with drug-resistant tumors. Immunotherapy has shown promise in other cancers, but not yet for ovarian cancer. For more information on the study, let me point out that they did publish it in the journal Cell, and if you go to the newsletter, I have a link to that. The team of scientists employed a powerful CRISPR tool, so it's gene modification, developed at the Icahn School of Medicine in Mount at Mount Sinai Hospital in New York, and they tested multiple factors produced by ovarian tumors, discovering that IL-4 played a crucial role in forming a tumor microenvironment that shields the cancer cells. Ovarian tumors are made up of diverse cell types, each using different factors to manipulate the surrounding cells to evade treatment. This environment impacts how a tumor responds to therapy, making it critical to identify these factors for potential therapies. The team's findings were striking. When IL-4 was inhibited, ovarian tumors became more susceptible to PD-1 inhibitors. This is a class of immunotherapy drugs that includes the commercial name is Keytruda. I'm going to mess up the generic name. It's pembrolizumab, and nivolumab, which has a commercial name, Opdivo. Now, by combining an IL-4 receptor inhibitor with PD-1 immunotherapy, they found a way to overcome cancer's resistance to immunotherapy. The study suggests that dupilumab, which is Dupixent, an IL-4 receptor inhibitor currently used to treat eczema and asthma, could be combined with PD-1 inhibitors to treat ovarian cancer. These drugs are in the marketplace. The study further revealed that IL-4 affects macrophages, a type of immune cell found in high quantities within ovarian tumors. Single-cell analysis showed, not macrophages. Single-cell analysis showed that macrophages change their behavior in response to IL-4, triggering a chain reaction in the tumor microenvironment that leads to immunotherapy resistance. Single-cell and pathological analysis of human ovarian tumors suggested that the same mechanism may be responsible for immunotherapy resistance in ovarian cancer patients. These findings are incredibly promising. While clinical trials are needed to confirm the efficacy of combining IL-4 and PD-1 inhibitors, the results in preclinical models give hope for improving the treatment outcomes for ovarian cancer patients. I also have a link to the University of Alabama news report on this in the newsletter. Trump nominee at NIH is a danger. All of this research is great, and it will help so many. But Trump has frozen the budgets once, and to be frank, that guy is untrustworthy. He is now proposing that Dr. Jay Bhattacharya of Stanford be the head of the National Institute of Health. Bhattacharya is a physician, he's a doctor and a health economist. His nomination requires Senate confirmation, and he would take charge of an agency that employs more than 18,000 and funds nearly 48 billion in scientific research yearly, through 50,000 grants to more than 300,000 researchers at more than 2,500 universities, medical schools, and other institutions. If he is confirmed, Bhattacharya could dramatically affect the future of medical science. The NIH is the world's largest public funder of biomedical research, but the NIH could be among the top targets for restructuring as the next administration tries to overhaul the federal government. Bhattacharya co-wrote an open letter called the Great Barrington Declaration, and I have a link to it in the newsletter if you can stomach reading it. It was released in October 2020, and it challenged public health policies such as lockdowns and mask mandates for COVID. The declaration called for speeding up that herd immunity by allowing people of low risk to get infected, and we should protect the most vulnerable, like the elderly. It was denounced by many public health experts as unscientific and irresponsible, and the phrase they used was fringe epidemiology. This is another MAGA doctor who's going to put our health at risk and the research we need at risk. I would point out that those people who didn't listen to get vaccinated and didn't follow mask mandates, according to the Lancet, that bad behavior was responsible for an excess 400,000 deaths in COVID in the United States. Look, Call or email your senators. Let them know that Dr. J. Bhattacharya is unfit to direct the nation's medical research at the National Institutes of Health, because during COVID, he opposed lockdowns and mask mandates, and he wanted people to get sick to hopefully build up a herd immunity. It is a cruel way to go, since an extra 400,000 Americans actually needlessly died that way. I have a link to your senators' phone numbers and emails as usual. It'll be in the bottom of the YouTube description box, or my favorite, send a text message, sign PF, I'm going to try and read it correctly, PFI PFM, sign PFI PFM to ResistBot using either Messenger, Telegram, or Instagram, or SMS. Just send the text message to 50409. Here's the message. I'm your constituent, and I want you to know that Dr. J. Bhattacharya, Trump's pick for the National Institute of Health, is unfit. He recommended letting people get infected with COVID-19 and opposed mask mandates to build a herd immunity. The problem is that 400,000 of us didn't obey, and requests to obey those mandates and requests to get vaccinated, and died, and they did not have to die. He will change the focus of research, and we cannot afford to have biased fringe ideas directing medical research and the health of Americans. I very strongly urge you to reject Dr. Bhattacharya. That's what I've got for you. Down below, like, share, subscribe, send me comments. Today's article was actually because someone sent me a comment and said, tell us about ovarian cancer research. So I'll do it. Send it here at YouTube or at healthcareadvocacy1@gmail.com. Have a good day.